last topic. I will focus on our program. My topic is a new model of global health education, special focus on the theory and field working. So I want to make our students how to conduct global health practical in the field. So I will very quickly go to introduce about the history of global health education. It's very important for our idea to design this program. But first, in the early 20th century, at that time, we don't have the global health. Maybe at that time we also have the international health. So at that time, the international health focused on exchanging the students to a different country to expose the new technology and to knowledge and learn the new medical skill. And in the World War II, due to the World War, so the focus is trained to the tropical medicine. So at that time, we are focused on the parasite and mainly the related disease. Later on in the 1960s, in the Cold War, at that time, in the USA, especially in the USA, they created programs like the Peace Corps to send their university students to a young adult to go to the abroad to offer their resources, especially American resources, to the third country, to the other different countries. So at that time, we had a lot of barriers. The barriers to traveling, the barriers of communication among the different institutions. So at that time, we don't have a lot of programs at that time. However, recently, there was a new trend. What kind of new trend in Taiwan, especially in Taiwan, about the volunteer service? Why do I talk about volunteer service? Because volunteer short-term service is very popular in Taiwan. Even in our medical school, a lot of the medical school students were sick. They will find summer program, the short-term program. Maybe they will find the resources from the School of Medicine. They will find the resources from the NGO. They will do their summer volunteer service especially in abroad. Okay. So that problem is that just Dr. Lin, the Professor Lin said about the global health education in Taiwan is very small because we are a small country and the School of Medicine is not big, it's very small. So if you look around overall, in Taiwan, Professor Lin said that we have a PhD program in our university. However, this is for international students, and the other two private university, one private university and the other public university that provide the master's program in global health. However, if you look at this from the College of Public Health, not from the School of Medicine. And if you look to see the core competency or core value of global health, we will talk about we will emphasize about the social justice, sustainability, some respect for the different cultures, something like that. And in comparison to the core values of the volunteer service, you will find they are almost the same. They have the same core values between the global health and between the volunteer service. So the problem is that we have a lot of if you find the online resources from the internet, you will get a lot of the online open resources in the internet. So we will know that in the global health, we will talk about the global health governance, we will talk about the MDG, and after the 2015, we will talk about SDG, something like that. Of course, the child and the maternal health is very important. However, the problem is that implementation. If you want to do implementation, like the first presenter, the Sue said that you have to execution and practical. So you want to do the execution and practical, you have to learn the skill, learn the knowledge, learn the capability about the planning, evaluation, the fundraising. You have to know the ethics to do these kind of things in different countries and different cultural backgrounds. So this is very important. So currently in Taiwan, at least in our School of Medicine, we have a gap. Even you go to the College of Public Health, you learn a lot of topics, but you don't know how to do the practice, how to do execute a plan in a different country or the other different cultural background. So lacking the problem is that in School of Medicine, we lack of the structural education program, and we lacking the core capacity building for the field work, and how to combine this kind of core value of global health and core value of volunteer service is very important for our medical students. So we have our infrastructure of the curriculum. Our name is Global Health and Service Learning. So we combine these two parts together. And this is a general course. from the School of Medicine. So these, I mean the students from all over the university, all the students from the can learn this program. We started this curriculum in 2013. Originally, it's designed from the 2 hours per week, and the semester we have the 18 weeks, and the students ever finish the course get 2 grades. So we have lecture, group discussion, and we provide all the 3 weeks student practical in one area we produce for you. And we have some 3 kinds of teacher. One is a social anthropology professor, and one is a project manager, like the first presenter. So she has a medical anthropology training, so he can talk about the different culture sensitive, something like that. And me, I'm a family physician, so I will have some overseas service like in Southern Brazil for at least 1 year. So I can provide the experience practical for our students. So this is our field. Our field is in the north area of the India. It's called Ladakh. The height is over than 3,000 meters, and initially we start our program in the 2012. At that time, only few workers. For example, in the 2012, we have only nurse and 2 doctors including this there. We do investigate, and with our partner there, we visit one school there and talk about them and what kind of help they want. And in 2013, we began to bring our medical students there and also invite the dietitian, just like we say in the workshop, yeah, because the child nutrition is very important. So we invite the dietitian to join our team. And in this last year, we have nurse, doctors, and also including pharmacists and the ed students. These all ed students finish the 18 weeks curriculum, and they went with us, go to the Ladakh for 3 weeks practical. So our core value is the local perspective from the local people. We want to emphasize empowerment, to empower the local people to do their own. And very important is that the sustainability of the program. So you can see this is the very simple structure of our program. Okay, so in the center is the self-operated healthcare system. How to support the self-operated healthcare system? We need to do the health examination, because this is from the concept of epidemiology. From epidemiology, we can run a lot of things, do the nutrition survey, and we will do lifestyle investigation, this health education program, and we will do the medical resources investigation to provide our health workers there to refill and to maintain their healthcare system. So our core value system is very professional oriented, because the medical students will co-work with our professional nurse, dietitians, pharmacists, doctors, and this is a multidisciplinary co-work, and they can learn the field capacity. We provide medical students with the community service and in the field, and to learn the core value of the global health. So I take one for example. For example, from health examination, students will enjoy us. After we do the health examination, they will do the core work. They have to try like the students from Park Health to do the data keying, and we will teach them to the data analysis. We will tell them how important to analyze and create a growth chart from the WHO criteria, and to analyze the growth condition of the children there. And the other part, we teach our students to do this kind of health passport for individual health students. They can this kind of health passport for each 2 students, and the school can use this health passport to their sponsor and get the most sponsor good. And in general way, our program is from the 2012, and from 1 school, and the next year we extended to 2 schools, 3 schools, and this year, this summer, we have finished this program. Not finished, we finished the program this year. So this year we enter the 1 local community, and all the data are still under the analysis. This is from the spectrum of service from the school to the local community, and from the future. Currently, this year, now this is our new semester, so we have our new program this year, and our students ask us to increase our hours. So now our curriculum have 3 hours per week. The students can get 3 grades, and we have a lecture, group discussion, of course, so we will provide a lot of case studies, and we invite our previous co-workers and our colleagues to come back to be our teachers. And this year, in 2012, in this summer, we are very happy to invite some non-medical students, and some students from the other college in university. They join us because they join us to provide their experience. Why? Because we very emphasize on the multidisciplinary co-work. It's very important in the global health. So our medical students and other non-medical students can learn this kind of co-value in our program. And I'm very fortunate. Fortunately, we have to build a long-term relationship with the local community. So in the future, we will communicate to our community and we can design our program here and do the practical in the Ladakh, in the north area of India. So I think this is a very brief introduction to our public health education in our school of management. Thank you.